Hi everyone, thanks for joining my section. The study is about paroxysmal atrial fibrillation prediction based on spectral temporal analysis of P-wave using wideband ECG with deep learning. I'm Heng Zhou with my advisor Professor Xianfeng Lin. We are from National Jiao Tong University in Taiwan. Atrial fibrillation is one of the most common arrhythmia proved to be linked to stroke. Predict upcoming atrial fibrillation in advance can offer clinical response time that the treatment can be applied to prevent stroke. We established a wavelength-based spectral temporal analysis to explore the morphological feature in P-wave and employ a convolutional neural network to classify the features in normal group, which is the data 2 hours ahead of PAF onset, and the prelude PAF group, which is the data within 5 minutes before PAF onset. We can see that the P-wave duration present much stable in normal group. In the same time, the high frequency band have been proved to increase in prelude PAF period. The prolonged P-wave duration and the morphological change are accepted as the indicator of atrial arrhythmia. We introduced an automatic standard to procedure to segment the beat-to-beat P-wave and apply to spectral temporal analysis. Moreover, we filtered and compared the conventional ECG and wideband ECG with skin sympathetic nerve activity. Because high-frequency signals suggest to reflect sympathetic nerve activity that play some roles associated with the onset of arrhythmia. The spectral temporal analysis including the wavelength transform with Mexican hat model wavelength, which is the most identical to P-wave, and we applied a spectral subtraction technique to neighbor P-wave. Spectrogram conduct morphological difference feature, which is a P-wave morphological variance. From the figure, we can observe that after the spectral temporal analysis, the P-wave variance in prelude PAF group is significantly higher than the normal group. The feature expressed the P-wave variance reflect the prolonged P-wave duration and the morphological dispersion, which refer to atrial unstable. And detect those characteristics manually are labor-intensive and unreliable. We classified the features in two groups by lightweight deep learning model. We deploy a classic funnel structure convolutional neural network since the spectral temporal analysis already extend the raw signal to two-dimensional spectrogram with only horizontal and vertical linear dependence. We apply separable convolution to reduce multiplications parameters to fasten the training process. For the result, we analyzed 8 patients suffer from PAF with 24 hours wideband ECG recording. The ECG and wideband ECG task reached 89 and 95% accuracy with 93 and 98 sensitivity and 85 and 93 specificity. The proposed method shows the efficiency on upcoming PAF episode prediction. We can see the specificity is highly improved by the information in high-frequency band. That made the classification accuracy significantly higher in wideband ECG task. Indirectly proved the effectiveness of skin sympathetic nerve activity extract from wideband ECG is possibly a favored indicator of atrial arrhythmia. As the table shows, previous work applied HRV analysis-based feature can only consider limited and indirect information. Those methods estimate by multiple indicators in P-wave which are laboring to detect. On the other hand, although the lack of appropriate feature extraction method should implement deep learning method to result in accuracy improvement. In contrast, our proposed method that combines spectral temporal analysis, features extraction, and deep learning approach demonstrate a remarkable performance and efficiency. We can conclude that the proposed method is a superior offer to existing risk assessment method. Thank you for your attention. Further discussion are welcome. Please refer to my email. Wish you have a nice day.